Welcome to Dr. Hassan. So today my group 8, will present about modified release tablet. You can see this is my group member, myself, my name is Rara Tujanna. I have Washa with me, Maizura and Zul. This is the overview of our project. On the modified release tablet, the overview, pharmaceutical product that is altered on the rate of release and the site of the release of drug substance of the medication itself. So the function of this modified release tablet is to sustain longer in the body of a human when administered by orally. So the release control is achieved by diffusion through a network of channels that exists between the compacted layer of polymer of the tablet. Hence, the objective of this modified release tablet is to prevent drug abuse, to reduce adverse effect to the human, protecting acid-sensitive drug, to increase the patient's compliance toward the medication by reduce the frequency of dosing of the drug itself, and then enhance drug bioavailability for especially for the short half-life of drug, and lastly to avoid irregular drug plasma concentration in the blood.
This slide shows the advantage of human creating the modified release tablet. First, oral sustained release or controlled release reduces dosing frequency to an extent that once daily dose is sufficient for therapeutic management. Second, it provides maximum utility of drug with reduction in local systemic side effect. The third, control condition in the shortest possible time by the smallest quantity of drug to assure greater pain compliance. And the last one is reduce cost reduction. It improves patient acceptance by consuming 1 tablet a day instead of 3 times a day like normal tablet.
Okay, this slide will show us the comparison between MR tablet and conventional tablet in their diffusion time. As we can see in the schematic picture, the MR tablet have a coating that will delay the diffusion time, while as conventional tablet doesn't have the coating, so it will have an immediate diffusion time.
This slide shows the graph of relationship between the concentration and the time taken for controlled release tablet and conventional tablet takes in the body. So for the conventional profile, it took a short period of time for it to diffuse and to excrete from the body. Meanwhile, the control profile took a longer time for it to diffuse in the body and excrete the body.
The recent novel technology for this modified release tablet, the first one is that I saw from the AstraZeneca website itself, which is the transient permeation enhancer, which allow the diffusion of drug, of macromolecules of drug across the GI tract. So this will increase the absorption against improve stability of the drug against instantaneous enzymes of the stomach or the gastric between the gastric juice, as well as increasing the half-life of the drug to improve oral absorption. And the next one is the DIFCOR, which is the technology used to development of the control release product. This came from the GSK, which is the GlaxoSmithKline, to increase the speed production of more controlled release tablets and other dosage form as well. Mainly is on the capsule and the tablet, so this will increase the production. A lot of classification in the modified release tablet. The first one is delay release, which consists of enteric coated tablet. The second one is the extended release, or also known as ER, XR, or XL on the packaging as shown at the figure below, at the example below. This extended release consists of controlled release and sustained release, as well as long-acting drug products. The third one is targeted release, and last but not least is the oral disintegrating tablet, which is to be absorbed on the tongue directly to the blood circulations. Product that we choose, which is the Voltaren sustained release 100 mg, that we will discuss about the formulation next. Formulation of the Voltaren sustained release, which is the name of the active ingredient is diclofenac sodium 100 mg. These are the list of the excipient used, which might a bit differ from the formulation previously, but this one is the original excipient used by the Voltaren SR itself. Which the first one we can see we have the carnauba wax, which function as binder. The properties of the carnauba wax is hydrophobic environment, and it controls the amount of water that enters the tablet matrix. And then next is the cellulose compound, which is function as a binder. It is contained of high swelling degree and retain high amount of liquid and soft consistency. Next is the colloidal silicon dioxide, which is the disintegrant. This acts as a carrier or facilitate enter the water, thereby leading formation of channel for the water to come in. So next is the cetyl alcohol, which is a hydrophobic agent as a coating agent. And then we have hypermallose, which is the HPMC, a common use coating agent in the tablet. It is a non-ionic plasticizer that works well with acidic or basic or other electrolytic system, and work well with soluble and insoluble drugs as either at low or at high dose. Okay, so next. Here, we have the polysorbate as a stabilizing agent to improve the drug solubility. And then we have povidone, which is hygroscopic powder as a binder to act as binder that might delay the release of the medication itself. And then red iron dioxide as a coloring agent for the Voltaren. Sucrose as a binder, and then to enhance the taste of the drug. Talcum is the diluent is an extremely crystalline, odorless, and powder that used to retard the dissolution of the drug. And last but not least is titanium dioxide as a coating agent. So a significance of this modified release tablet excipient is on the polymers used in this excipient. So for example, the HPMC, the carnauba wax, the cellulose compound, and the other coating agent as well play an important role to create a matrix. It's like a layer network for the drug to diffuse slowly or disintegrate slowly when released into the gastrointestinal or any other targeted site. Okay, so different coating agents have different properties, which is hydrophobic and hydrophilic, or even only lipid soluble. So this can be modified depends on the drug purpose.
So we will explore the pivotal topic of evaluating products using pharmacopoeia standards, a journey into the meticulous processes shaping the safety, quality, and efficacy of the healthcare product. The significance of testing in the pharmaceutical industry is undeniable, particularly in ensuring the safety and efficacy of products. In the evolution of our modified release tablet containing diclofenac sodium, understanding the necessity of testing becomes crucial. With comprehensive testing, we affirm our commitment to patient safety. The assessment of the modified release tablet ensures not only efficient delivery of the active pharmaceutical ingredient, but also ensures the reliability and safety of our pharmaceutical formulation. Okay, next. So in our product, we will do this integration test. And usually, the test is to measure the time taken for the tablet to break down in the body to ensure efficacy. The tablet will be immersed in simulated intestine or gastric solution. The time for tablets to break down is measured. And based on pharmacopoeia, the simulated solution that can be used may either be intestine or gastric fluid. And mechanical force may also be applied to the solution. The temperature and pH are the exact same with the human body. Okay, next. So in our product, we also do dissolution test. And this test is to ensure the API will dissolve within a specific time to be released in controlled and consistent manners to be properly absorbed by the body. These tablets will be immersed in simulated intestinal or gastric solutions. After the specific time, the amount of dissolved tablet will be measured to determine and the rate of drug being released from tablet. And based on pharmacopoeia, the simulated solution that can be used may either be intestine or gastric fluid. The temperature and pH of the solution must be monitored and controlled to be exact, same with the human body. Lastly, they need at least 80% of the tablets to be dissolved within the specific time. So this slide is about specific tests of diclofenac sodium. And we go to the color of solution first. A solution 1 in 20 of diclofenac sodium in methanol is colorless to vanilla yellow, and the absorbance of the solution, determined in 1 cm cell at 440 nanometers, is not more than 0.050 methanol being used as the bank. And we go to the clarity of solution. The solution prepared as directed on the color of solution is not significantly less clear than an equal volume of methanol contained in a similar vessel and examined similarly. And the sample solution, the solution 1 in 100, and the acceptance criteria 7.0 until 8.5, and the analysis dry at 105 degrees until 110 degrees for 3 hours, and the last one is the acceptance criteria not more than 0.5%. Identity test using spectroscopy for infrared spectrum of the drug, and the potency test is measuring amount API present to substances that contributes to biological activity. And the last one is impurities. Purity test check for substance or impurities.
Okay, now I will explain about diclofenac sodium in other dosage form. Diclofenac sodium have many dosage form, but this we will discuss about Voltaren gel, which is a gel dosage form that have topical route of administration that will have bioavailability by local effect. This research we find a clinical studies from National Library of Medicines where they pull safety analysis between comparing diclofenac topical solution and oral diclofenac. Diclofenac topical solution can be considered as useful alternative to oral NSAID therapy.
From the clinical study that already explained, we attained two different types of solid dosage form comparison. from the route administration, patient acceptance, bioavailability, and their therapeutic efficacy. So for MR tablet, route of administration is oral, and for gel is topical. MR patient acceptance, it requires swallowing a pill and may be less convenient for patients with difficulty swallowing or who prefer non-oral administration. Gel, the patient acceptance is easy to apply, non-invasive, no oral injection required, and convenient for localized pain relief. Next, for the bioavailability MR tablet, it is a systemic absorption, result in higher drug levels in the bloodstream. It increases the potential for systemic side effect. It also can be available in body for a long period of time. Meanwhile, gel provides localized drug delivery to the site of application, minimizing the systemic exposure, and it reduces the risk of systemic side effect. It affects on short period of time and affect locally. For their therapeutic efficacy, modified release tablet provide both systemic anti-inflammatory effect and pain relief. Gel relieving pain and improving the physical function in the patient with osteoarthritis of the knee.